Ready? Hi, everybody. Wasn't planning on giving a briefing, but want to give you an update on where we are with a couple things related to COVID. And I just thought with some of the data I have to report and to really offer some dignity with the news. We just got a report. We've lost 18 members of the community, 5 of them in the hospital over the last 24 hours, male, ages 79, and 66, female, ages 92 and 64. The New York State Department of Health website updated 13 members of our community have died in nursing homes. I don't know if they died over the last 24 hours or 48 hours or 72, but that was reported, so it will go in under the assumption that they died over the last 24 hours. We've lost 18 neighbors, the deadliest day we've had in the pandemic, I believe. This is crushing news, and certainly my heart and all of our Onondaga County team goes out to the families of everybody we've lost. But to have this type of news on a day like this, I just thought it appropriate that I brief the community. On the new case front, third straight day under 300 cases, 297 cases today. Today's a busier day usually in our reporting as we have backlogs from the weekend come through. So when you look at where we were a week ago, 400 up to 460 cases. We've now had 3 straight days in that 275 to 300 range. Tomorrow's usually the worst day for us with new cases. Early indicators are maybe a little bit higher than where we are today, but it doesn't look like we're going to be in that 400 range. So that's positive. So our caseloads week over week are dropping. It looks like we saw our Thanksgiving peak. Now we're coming back down. Depending on how far we come back down is really up to us. I think with all the sobering data that we've seen, the residents we've lost, hopefully people are reevaluating some of their plans for the holidays and are going to make severe modifications to their gatherings, especially even with your own children when they're out on break. Please be conscious of the fact that if we treat this like we did in the beginning with our interactions, we'll get these numbers down more, and then we'll have less people getting sick, going to the hospital, and we'll lose less people to this virus. Hospital numbers, I'm going to give you the COVID numbers for our county. I'm going to give you the COVID numbers overall in the hospitals in our county, and then I'm going to give you the total numbers of where we are with capacity. We have 299 residents of our county in the hospital related to COVID-19. Our total hospital numbers in the county are 1,256. These are folks who are sick in the hospital. The 1,256 out of, when you add in the 25% surge beds that are available, out of 2,117 beds. So you can see the capacity is not an issue. Out of overall COVID-related hospitalizations, these are people who are coming into hospitals in our county from other counties as well. And these folks are in our 1256 number, 377. The number of people waiting to leave the hospital, this is key. You've heard me talk about the nursing home or assisted living facility resident who's no longer needing hospital care. That number has grown quite a bit for not just our county but all the counties. We put forward a plan to the state. We believe the state will approve the plan shortly. When they approve the plan, 88 residents will go into this facility. That's 88. We have 1,256 people in the hospital. When the plan gets approved, that's going to drop by 88 beds. 88 people can go. So that's going to be big. Again, solidify our capacity, give some of our hospital workers a little bit of of a break and breathing room. When we look at recoveries, we had 773 recoveries of the virus today. That's a big number. That's a good day related to that. When we look at the caseload being in a better spot this week, we've now had 3 straight days of data to show us that we believe that's kind of a trend, that we're going in the right direction. Certainly, hospitalizations, if we can get these 88 residents into a more comfortable setting for them and getting them out of the hospital, that number will be going in the right direction. Our positivity rate, I think our daily positivity rate's around 6.5, so getting better. But the damage is done when you're vulnerable getting the virus, and then they get the virus, they get very sick, and we're losing members of the community. Very, very painful day overall. I'll update the community later via social media on how many vaccinations today. Today, I believe, was a busy day with our frontline workers getting vaccinated. And then tomorrow at my briefing, I will update the community on many of the nursing home schedules. I won't give too many specifics. I'll just give you an idea of how many people are going to be vaccinated next week, because many of the nursing homes will begin to be vaccinated next week, and that will be really good news. As we saw, 13 residents of nursing homes passed away, so we need to get these people that vaccine as soon as possible. Saying that, I will see many of you at my briefing tomorrow, and let's just keep these families in our thoughts and prayers.